So I hear that you guys are going to have an adult children's conference coming up later this month. I think it's May, 19th and 20th. So I encourage all of you to attend and tell your kids about it. So remember that Parkinson's disease doesn't just affect the patient, it affects the whole family. And that for your family to be a good advocate for you, that they need to be involved and they need to know what your Parkinson's is like, how it's being treated, what medicines you're on, what milligrams and what the names of those medicines are. Are you allergic to any medicines? So that way when something happens, either you have a bladder infection or a flu and you can't remember yourself what medicines you're on and you end up in the ER, your son or daughter can say, hey, she's allergic to penicillin or she's on Stalevo 200 milligrams 5 times a day. And so that they can better treat you in the ER and avoid any thing like giving you the wrong medicine, the wrong antibiotic, and extending your hospital stay. So remember, this is a family disease. It affects everybody in the family, and everybody needs to be well informed. The more well informed you are, the better able you are to treat the things that come up, and the better able your family is able to make the decisions with you as to should I be going to assisted living, should I go to another independent care center, should I try another therapy like a duopa that involves a peg tube or things like DBS that involves surgery. So the more well informed your family and your children are, the better able the whole family is able to treat the disease. So what may happen is that patients who've been very high functioning, who have been taking care of all of their activities, financial problems, everything, they pay their own taxes for 80 plus years, are used to doing everything themselves. They don't want to be a burden to their children. But what happens in Parkinson's, sometimes you may get to the point in the disease where you're more sensitive to the medicines, or if you get a bladder infection, you're more prone to have confusion or hallucinations. Then, somebody comes into the home, you're not coherent enough to give a good history to see what happened. Did you take extra medicines by accident? That's why you're dyskinetic, that's why you're confused, that's why you're hallucinating. So if there's a caregiver or one of your children or another family member that knows what you're taking, or that can reach into your purse and say, here's the list that she's on, everything's written neatly, what you're on, how many milligrams, what times a day, who your doctors are, the phone numbers, then when you get to the hospital, it's better to figure out what happened and how to treat it. So is it just an overdose that you took too much levodopa? Do you have an infection? Is there a flu or meningitis that we need to take care of? Something like that. So, but remember that we all get to that point. Right now we think, no, I'm never going to get old. I'm always going to be paying my own taxes and taking care of my own bills and doing my own banking. But there will be a point where we need somebody else's help. And the better informed that person is, the better they can help us.
Speaking as an adult child, please tell your kids and family members about this conference and about PMD Alliance. Trust me, they want to know.